Hello, everyone. You're watching Eagle News America. I'm Thomas I. Likeness, broadcasting from our studio in Edmonton, Canada. It's Monday, March 29th, 2021 on this side of the world. And a good Tuesday morning to our viewers in the Philippines. In the news, we have updates from several of our correspondents from across North and Central America. May Davila in Panama tells us visitors from Brazil have been banned from that Central American country. Arlene Ocampo in Fort Washington, Maryland.
The state of Maryland launches mobile vaccination units.
We'll also hear from Mayan Manzano Garzon in Sicklerville, New Jersey.
New Jersey expands eligibility for COVID-19 vaccination, and their outdoor gathering limits and capacity for large venues to increase.
Also joining us, Mila Simbulan from Swarthmore, Pennsylvania.
Pennsylvania Department of Human Services highlights COVID-19 vaccinations for child care providers.
Lori Jarvina in Las Vegas reports about the governor addressing violence toward Asian Americans and Pacific Islanders. Nanita Manawis in Dallas will report on Texas reaching that 10 million mark for COVID-19 vaccines. And from the environmental file, Melissa Allen in Lakeland, Florida, tells us about manatee deaths in the states soaring this year. Plus, we'll hear from EBC friend Ethel Constantino in Raleigh, North Carolina. She tells us how she reaches out to the homeless there. And for tonight's roundtable, we're going to talk about the lasting changes the pandemic has made to our lives and how it has affected us individually. Our coverage begins now. Protesters gathered outside the courthouse in Minneapolis as the murder trial began for former city police officer Derek Chauvin. Chauvin is accused of murder and manslaughter for his role in the May 25th death last year of George Floyd. Now, you recall Floyd's agonizing death ignited protests against racism and police brutality across the United States and around the world. In opening arguments this morning, lawyer Jerry Blackwell told jurors they'll hear from a 911 dispatcher.
There was a fixed police camera that was trained on this particular scene, and she could see through the camera what was going on. You would learn that what she saw was so unusual and for her so so disturbing that she did something that she had never done in her career. She called the police on the police, a 911 dispatcher.
Now, that dispatcher Blackwell referred to was Jenna Scurry. Scurry took the stand later in the day to explain just why she called police to report what she saw.
It was a gut instinct of, in the incident, something's not going right. Whether it be they needed more assistance, or if there just something wasn't right. I don't know how to explain it. It was a gut instinct to tell me that now we can be concerned.
Defense lawyer Eric Nelson in his opening arguments rejecting suggestions that Chauvin was responsible for Floyd's death.
The evidence will show that Mr. Floyd died of a cardiac arrhythmia that occurred as a result of hypertension, his coronary disease, the ingestion of methamphetamine and fentanyl, and the adrenaline flowing through his body, all of which acted to further compromise an already compromised heart.
The trial is being live streamed because of the pandemic. You see, there's no room to accommodate spectators in the courtroom. U.S. President Joe Biden ramping up the country's COVID immunization campaign. Biden says over the last 3 days, 10 million shots of the vaccine have been administered. And he says 9 out of 10 Americans will be eligible for vaccination by the middle of April.
So we're moving toward 90-90 by April 19th. That is by April 19th, 3 weeks from today, 90% of adults, people over 18 and over, will be eligible to get vaccinated. 90% of all Americans will be living within 5 miles of a place they can get a shot.
But he warns the war against COVID-19 is far from being won. He blasted people that he says are responsible for what he calls reckless behavior over the past few weeks. He says that has left the country on the brink of a fresh surge of the infection, and Biden wants people to mask up.
I'm reiterating my call for every governor, mayor, and local leader to maintain and reinstate the mask mandate. Please, this is not politics. Reinstate the mandate if you let it down. And business should require masks as well.
After plateauing for several weeks, the rate of infection in the United States is on the rise again. Now, the country's averaging close to 60,000 new cases every day. I saw a report a few hours ago. In it, the director of the Centers for Disease Control and Prevention, her name is Dr. Rochelle Walensky. Dr. Walensky made an emotional appeal to Americans not to be complacent. She reflected on COVID-19 patients that she treated, patients that didn't make it, and she summed it up with these words: right now, I'm scared. That's what the head of the Centers for Disease Control and Prevention said. Right now, I'm scared. And I think that fear is being felt by many worldwide. Let's look at the COVID-19 numbers now, provided by the Coronavirus Resource Center of Johns Hopkins University in Medicine. As of 6 p.m. Eastern Time today, the number of cases of COVID-19 reported worldwide, now more than 127,422,000. Top three on the list of countries with recorded cases: the United States, more than 30.2 million. India, more than 12.5 million. Brazil, more than 12 million. And sadly, more than 2,787,000 lives worldwide have been lost to this virus. Top three countries with the most number of COVID-19 related deaths: the United States, more than 549,000, Brazil, more than 312,000, and Mexico, more than 201,000. Canada has suspended the use of the AstraZeneca vaccine in adults under the age of 55. Why? The risk of rare blood clots. The move follows a recommendation from the country's National Advisory Committee on Immunization. Health Canada will do a risk-benefit analysis on emerging data before that vaccine is resumed for use. Now, it was only last week that Health Canada issued a statement touting the safety and effectiveness of that vaccine. Canada is expected to receive 1.5 million doses of it from the United States. The U.S., incidentally, has not approved the AstraZeneca vaccine for use there. President Biden weighing in on the violence in Myanmar. In the bloodiest weekend yet, more than 100 people died in the junta's crackdown.
It's terrible. It's absolutely outrageous. And based on the reporting I've gotten, an awful lot of people have been killed totally unnecessarily.
The death toll from the military's crackdown since the February 1st coup has climbed to at least 459. On Monday, funerals for some of those killed over the weekend. Phil Robertson, he's the Deputy Asia Director for the Human Rights Watch. Robertson says the violence shows the real face of the military, and he doesn't expect the protests to end soon.
My sense is that we're into this for the long haul. I mean, the people of Myanmar are not going to step back. You know, they have been under military dictatorship in the past. They spent almost 5 decades under military rule. And they know what it means. And they know that going back is not an option. So I expect we're going to see continued resistance. We're going to see continued protests. We're going to see people manning the barricades. And we're going to see more and more people killed. This is going to be an ongoing tragedy. My greatest fear is that the international community loses interest and decides to think about something else and leaves the Myanmar people to their fate.
Shipping traffic moving again through the Suez Canal. That's 6 days after a container ship blocked the busy shipping lane when it became wedged between the banks of the canal. Tugboat crews sounded their foghorns in celebration after they managed to dislodge and refloat the Ever Given container ship. Now, that blockage stopped all traffic from passing through the canal. The Suez Canal authorities say it will take more than 3 days to clear the backlog of ships. Now 425 of them waiting to get through there. The blockage has cost the Egyptian government more than $12 million a day in lost tolls. And it's created problems for Europe and Asia. You see, those two continents rely on the shipping route to move goods between them. To free the ship, it took 13 tugboats, and workers had to dredge 30,000 cubic meters of sand. The vessel will be inspected to make sure it's seaworthy. The accident blamed on high winds, poor visibility during a sandstorm, and the Canal Authority hasn't ruled out the possibility of human error. A bit of sad news. The grandmother of former U.S. President Barack Obama has died in Kenya. She was 99. Sarah Obama, she was popularly known as Mama Sarah. Well, she'd been in hospital for about a week, tested negative, though, for COVID. Once a simple country woman, Sarah Obama was a long time best known for the hot porridge and donuts that she served at a local school. But she rose to world fame in after the 2008 election of her stepson, Barack, as the first Black American president. Peter Anyang Nyong'o, the governor of Kisumu County in Kenya, expressed his condolences.
We are here with a family who have been the closest people to Mama. And I'm sure the news must have reached his grandson and his family, the former President Barack Obama. With this family, we share the loss of a great-great-grandmother, a great mother, a great Kenyan.
Up next, we'll have stories from Panama, Maryland, and New Jersey. Eagle News America continues.
Factual.
We have to defeat the virus everywhere.
Timely information. Balanced, not only in the country, but also abroad.
I'm certain of one thing.
Interviews that people need to know. Watch Aguila Pilipinas. A 1-hour newscast of reports coming from regional hubs in Luzon, Visayas, and Mindanao. Know the important updates in Asia in ASEAN in Focus. Track the latest stories in the provinces in Aguila Provincia. Tune into Mata ng Aguila, the evening primetime news program of Net25. Balanced and objective, Mata ng Aguila covers national and international issues, tackles news on business, health, science and technology, entertainment, sports and human interest features, and current events. And Eagle News International delivers the latest global reports, impartial, accessible, and up-to-date. It brings to fore EBC's rich international scope and access to valuable information streams.
Well, thank you to explain our help outdoor.
Catch these programs on Net25. You can also watch our news programs through eaglenews.ph and Eagle News Facebook page and YouTube channel.
Higit sa boses, puso ang sandata ko sa pagkanta.
You surprised all of us. Hindi ko in-expect yun.
Upang mga awit ko'y inyong madama.
Ang kukumpleto sa line-up ng second semi-finals, Carl Aris Tanueco!
Ako po si Carl Aris Tanueco, ang pambato ng Angeles City, Pampanga.
watching Eagle News America. I'm Thomas I. Likeness. The Central American country of Panama has banned travelers from Brazil. Now, this is because of the appearance of the Brazilian variant of COVID in the country. And with more on that story, we have Eagle News correspondent May Davila.
The Ministerio de Salud or MINSA announces the P1 SARS-CoV-2 variant has been detected in the country in a positive patient from Brazil. The patient is a foreigner living in Panama who traveled to her country of origin, went to Brazil, and later on returned to Panama. Due to her background, the sequencing was carried out and she was found to be a carrier of the P1 SARS-CoV-2 or Brazilian variant. This variant has the particularity of being more contagious, virulent, pathogenic, and transmissible than all the variants known so far worldwide. It can be twice as transmissible and evade the immune response as well as affect young people. The effectiveness of the vaccine against this variant decreases by 30%. For this reason, the MINSA decides to temporarily suspend the entry into the national territory of any person who has stayed or traveled through any country in South America in the last 15 days. The said variant spreads rapidly in this geographic region of the continent. This measure exempts nationals and residents in Panama who, when entering by any route, air, sea, or land, must undergo a COVID-19 test and quarantine at the points of entry into the country. Starting March 28, it is mandatory for people who come from the countries of South America or have been in the last 15 days in an area of the continent to perform the antigen test or PCR prior to the registration in the airport immigration, since the International Health Team has detected patients with negative tests but have come out positive hours after entering the country. Starting Wednesday, March 31, only nationals and residents of the Republic of Panama who come from this area will be allowed to enter the country, but must strictly comply with the protocol established by MINSA. MINSA recommends nationals and foreigners residing in Panama not to visit any South American country and asks their general population to increase biosafety measures such as the correct use of masks and face shield, hand washing, maintain physical distance, and maintain the bubble from home during the coming national holidays in the country. Desde Ciudad de Panama, May Davila, Eagle News. Vivimos en tiempos interesantes.
In Maryland, they're taking the vaccine to the people. Arlene Ocampo is standing by in Fort Washington with the details. Thanks for joining us this evening, Arlene. So they're actually bringing it to people.
Yes, thank you, Thomas. With the expansion of vaccine distributions, Maryland Governor Hogan and the Federal Emergency Management Agency announced the launching of the nation's first federal mobile COVID-19 vaccination units here in Maryland. These units are funded and operated by FEMA and will be manned by trained clinical staff and vaccinators from the state, county, and federal agencies. The 32-foot trailer vaccination units include staff office space, storage for administrative items, generators, and cold storage for vaccine doses. Each unit is also designed to provide a minimum of 250 doses daily. The appointments will be booked through the health department. The 2 roving sites will provide vaccinations to the following: those who live in remote areas on the Eastern Shore, those migrant and minority populations, along with those who may not have transportation to commute to and from a standstill vaccination site, and also those who work in food, poultry processing, and manufacturing plants on the Eastern Shore. Acting Secretary Dennis R. Schaefer of the Maryland Department of Health said, and I quote, "We're excited to be the first state in the nation to include a collaboration with FEMA in our mobile vaccination efforts, and we are pleased to offer Marylanders near the path of these units the opportunity to get vaccinated close to home. These mobile sites are just another option to get vaccinated along with the mass vaccination sites and other participating providers, hospitals, pharmacies, and the like." Meanwhile, as the state of Maryland continues to prepare for an increase in vaccine supply from the federal government, the state will open 6 more vaccination sites starting in early April, doubling the number to 12. The timeline is as follows. The Timonium Fairgrounds in Baltimore County and Montgomery College in Germantown will be converted to a mass vaccination site in early April. In mid-April, there will be locations in Anne Arundel and Frederick counties. The dates and locations will be announced once the details are finalized. And in late April, Harford and Howard counties will have sites as well. So let's continue to be safe out there, wash our hands frequently, continue to social distance, wear your mask, and please get vaccinated when it is your turn. In Fort Washington, Maryland, Arlene Ocampo, Eagle News, we live in interesting times. Back to you, Thomas.
Arlene, those mobile clinics have got to be good news for a lot of people who have trouble getting to the traditional sites for vaccination. But what I'd like you to do is update me on how vaccines are going in Maryland. Are they on target? How many people have been vaccinated?
Yes, Thomas. Actually, there's a total of 2,564,507 COVID-19 vaccines that have been dispensed and are averaging a new record, a high of 49,732 shots per day. And starting tomorrow, state of Maryland will be entering phase 2B, and this will include those who are 16 years old and over, who have underlying conditions and disabilities. They will be eligible to receive the vaccine. And those also that are eligible under phase 1, 2A, and 2B, they can still pre-register online, at covidvax.maryland.gov, or call the state's COVID-19 vaccine support at 1-855-MD-GOVAX. Thomas?
Arlene, are supplies holding up? Have you heard of any clinics running out and having had to cancel appointments? Is there enough inoculant to put into people's arms?
There are. It's more of a waiting time of the appointments. So we just have to be patient and just wait our turn. Thomas?
Patience is the key. Patience,
Yes.
Definitely the key. Before you go, could you give us the status of the state health insurance enrollment period?
Sure, Thomas. So the Maryland Health Connection, they actually extended their current coronavirus special enrollment period until August 15th. So those uninsured Marylanders have until August 15th to enroll, and those that are interested, they can visit marylandhealthconnection.gov to obtain more details in enrolling for the health insurance. Thomas?
Thanks for joining us, Arlene, and do stick around. We look forward to hearing your thoughts during our roundtable at the end of the program. Well, we've got a couple of items to report on from New Jersey. The state is expanding its COVID vaccine eligibility, and outdoor gathering limits have been increased. That's got to be good news. EBC's Mayan Manzano-Gerzon joins us live now from Sicklerville with the details. Welcome, Mayan.
Thank you, Thomas. Governor Murphy announced on Friday the expansion of eligibility for more frontline essential workers and high-risk groups in New Jersey's COVID-19 vaccination program. Eligible groups include individuals ages 55 to 64, individuals with intellectual and developmental disabilities, higher education educators and staff, and communications and utility infrastructure workers, among others. Take a look.
Today, I am also proud to announce the next expansion of vaccine eligibility, which will take place beginning on Monday, April 5th. Remember, there's a whole group of folks who are going to be eligible this coming Monday, March 29th, including essential retail workers, longshoremen and women, and other groups. But as of April 5th, so a week from Monday, all New Jerseyans age 55 and over will be eligible for vaccination. That includes, by the way, my wife and me, and I'm going to make my vaccine appointment, as will she, through the same process that millions of New Jerseyans have done for theirs. All individuals with intellectual and developmental disabilities will also be made eligible. Through a partnership between the Departments of Health and Human Services, We have vaccinated residents and staff at our state developmental centers and group homes. This expansion on April 5th will bring all individuals, regardless of where they reside, with intellectual or developmental disabilities, age 16 and over, they will be eligible. Additionally, we will be moving to the next tier of essential workers based on their employment sector. As we're at Keene University, I should start by saying we will announce that this expansion will include all educators and staff at our institutions of higher education. This expansion will also cover all librarians and staff at municipal and county and state libraries. Also included in this April 5th expansion are workers in the retail financial sector. And we know this is important for all customer-facing workers especially. The same will go for workers at laundromats and dry cleaning businesses. We will also open eligibility for all in the building and home services industries, including construction workers, code officials, plumbers, electricians, HVAC technicians, and property management and maintenance workers. Those who work in communication infrastructure and IT, in the public utility sector, and all sanitation workers will also be made eligible. And to our friends in the media, you will be included in this expansion for April 5th, regardless of the tough questions you ask me. Although I should hold that out here until the end of this press availability. Many of you have been right there on the front lines with those fighting this pandemic and speaking with the New Jerseyans who have been most impacted, and you have kept your communities informed, and we thank you for that.
Well, good for us here in New Jersey, Thomas. Media people are now eligible for vaccination. In other news, today Governor Phil Murphy signed Executive Order number 234, which will increase outdoor gathering limits and increase capacity for seated events at large venues. The order also clarifies indoor capacity limits for banquet halls and similar venues. Take a look.
First, I'm signing an executive order increasing the general outdoor gathering limit to 200 people effective at 6 a.m. this coming Friday. Religious services, political activities, weddings, funerals, and memorial service occurring outdoors will continue to be uncapped. The general indoor gathering limit will remain at 25 people. The reason we are increasing the outdoor limit is that as the weather gets warmer, we are urging everyone to engage in social activities outside whenever possible. We know this virus is many times more transmissible indoors, and you've heard that from us, I think, hundreds of times, than it is outdoors. So any type of larger gathering is safer for everyone if it can be held outside. Additionally, and also effective on this Friday, we are lowering the threshold seating capacity for venues to be considered a large venue down to 2,500 from 5,000. This is in fact an expansion, even though it sounds like I'm contracting. So the definition of a large venue is no longer going to be, as of Friday, 5,000 capacity and up, but 2,500 capacity and up. And at those large venues, the capacities for indoor seating at these locations will be increased to 20% for indoor venues, up from 10%, and from 15% up to 30% for outdoor venues. So that means if it's a 5,000 seat capacity, they're now able to get 1,000 people into those seats. Based on discussions with our large venues, we know that at 20% capacity, our venues can still ensure that all groups remain 6 feet apart in all directions. This means we can safely take this step and welcome more fans into our arenas. In both cases, to remind everybody, all public health protocols must be observed by all participants and spectators, especially for the wearing of face masks by all spectators indoors.
And for New Jersey's latest COVID-19 numbers, the Department of Health has reported another 3,174 new positive cases today, bringing our statewide total to 792,616. Sadly, we are also reporting 16 new confirmed deaths, pushing the total to 21,869 fatalities. On the brighter side, the latest total of COVID-19 vaccinations already administered here in the state of New Jersey is now 4,500,000 30,061. And for a quick weather update, Thomas, it's currently 10:09 in the evening here in New Jersey, and it's currently clear. It is 43 degrees Fahrenheit or 6 degrees Celsius. In Sicklerville, New Jersey, May and Manzano Garzon, Eagle News, we live in interesting times. Back to you, Thomas.
Hey, Ann, can you tell us how the vaccines are being distributed or allocated in New Jersey?
Well, Thomas, according to Judy Percy Kelly, the Commissioner of the Department of Health here in New Jersey, allocation varies every week depending how many doses are they getting. And the allocation formula that she mentioned includes the equity, the percentage of the population, particularly communities of color, disease burden, that's per 100,000, social vulnerability index, and how quickly each site can administer the vaccination, and of course, the inventory. Thomas?
Arlene, you know, your state, your area is like a number of other places. You're seeing a rise in the number of cases. Mayanne, is there any indication as to what's causing this?
So actually, Governor Murphy mentioned a couple of factors that is affecting the increase in our positive cases, as I've reported as part of the report. So he mentioned that there's some amount of quarantine fatigue, so people are going out more. There's there's the COVID variants, of course, as we all know, and the population density here in New Jersey, Thomas, as one of the most dense states in the nation. Thomas?
Yeah, when you start packing that many people together, Mayanne, yeah, there's no doubt you're just making it an ideal breeding ground for the virus. I mean, they just love it. You can't really separate people, especially in large housing complexes and so on. Thank you for joining us, and do stick around because we want to hear your thoughts on the pandemic when we meet at the roundtable in just a little bit. Still to come, we've got stories from Pennsylvania, Nevada, and Texas. This is Eagle News America.
Innovation, digital disruption, globalization, startups, micro, small, and medium enterprises, as well as large corporations, all face interesting challenges in the market today. Peek into the world of exciting opportunities and partnerships to drive growth with the latest business news and information. We are open for business. Your weekly dose of entrepreneurial inspiration to update you on the latest developments in the world of business. Get up close and personal with CEOs and thought leaders to help you discover valuable insights. Sharpen your instincts for smart decision-making with the latest markets and economic trends, disruptive ideas, global innovation, social entrepreneurship, and other leading-edge business ideas. Join the conversations to create a more vibrant environment for entrepreneurship. Catch Open for Business, from vision to action.
Watching Eagle News America, I'm Thomas I. Likeness. Child care providers in Pennsylvania, they're now in line to get COVID vaccination. And joining us now from Swarthmore, Pennsylvania, Eagle News correspondent Mila Simbulan. Mila, this must be welcome news for them.
That's right, Thomas. Good evening and good morning to all those who are watching us from the other side of the world. Pennsylvania's childcare industry has been greatly challenged during the pandemic. This initiative is easing access to COVID-19 vaccines for dedicated childcare workers across the Commonwealth, many of whom care for children of essential workers, and will help keep childcare facilities safe for staff, children in care, and their parents and families that rely on this vital service. Earlier this month, Governor Wolf announced that Pennsylvania would use its initial supply of the one-dose Johnson & Johnson or Janssen vaccine for pre-K-12 teachers, other school staff, and childcare, and other early childhood education or ECE workers not affiliated with an intermediate unit or school district. This special initiative is allowing Pennsylvania to quickly and efficiently get vaccines into the arms of educators and school professionals to help schools safely resume in-person operations or phase back into full-time in-person instruction. Here's Pennsylvania Department of Human Services Secretary. Take a look.
In recognition of the critical role child care providers play in both cultivating young minds and helping parents work and keep our economy going, Governor Wolf and the COVID-19 Vaccine Task Force announced earlier this month that child care providers and their staff would be able to be vaccinated through a special initiative using Pennsylvania's supply of the Johnson & Johnson vaccine. This initiative also directs vaccine to educators, school staff, and early childhood staff that are affiliated with schools. Staff at child care facilities like the Children's Garden are able to be vaccinated directly through the Retail Pharmacy Partnership, which includes multiple pharmacy chains across Pennsylvania, including Rite Aid, Topco, and Walmart.
More than 17,000 child care and other ECE workers at nearly 3,700 facilities have signed up to be vaccinated through this initiative. These totals include independently owned family child care homes and group child care settings with a few staff, as well as large child care centers and community-based agencies that operate Head Start or early intervention 0 to 3. Right now in Smartmore, Thomas, it's 50 degrees Fahrenheit or 10 degrees Celsius with clear skies. In Smartmore, Pennsylvania, Myla Simbula and Eagle News, we live in interesting times. Back to you, Thomas.
Milo, was there any federal or state money that you know of provided for child care services?
Yes, actually, there is approximately $220 million in funding that came from the Coronavirus Aid Response and Economic Security, of what we call CARES Act. And it was allocated to support child care providers across Pennsylvania since the COVID-19 crisis began. Also, the funding supports this critical educational and economic infrastructure for children and families. There's also more than $300 million that was allocated to Pennsylvania through the Coronavirus Response and Relief 2021, or what we call CRRSAA, be distributed in April. And also, child care providers seeking more information on these funds actually can visit the CRRSA funding opportunity. There's also one more, the American Rescue Plan. The American Rescue Plan Act also contains significant financial support for child care providers. And Pennsylvania right now is actually currently evaluating the enacted law and available funds to determine how they will be distributed, and there will be more information will come as plans are finalized. Thomas?
Milo, do you know anyone who is dependent on child care to take care of their children so they can get back to work? Do you know of anyone that was greatly affected by this pandemic?
Fortunately, Thomas, I'm not dependent on childcare. My children are already big enough that they can do their online schooling here at home sometimes without even my help. But I do have some friends, especially those who work at the hospitals, those essential workers. Even during the beginning of the pandemic, it was really hard for them to go back to work because, especially when the school closed and they have to stay at home. And most of the child care providers here in Pennsylvania were also not available or closed due to the pandemic. So they were. I know I've seen their pain, and it's good that the state is really working on putting back all the child care centers out there. Thomas?
Good to hear that happening, Mila. Stay with us. We'll look forward to talking with you at our virtual roundtable. We go to Nevada now, where the governor has weighed in on the issue of violence against Asian American and Pacific Islanders. EBC's Lori Jarvina has that story.
Thank you, and greetings to all our viewers in America and abroad. On March 25th, Nevada Governor Steve Sisolak hosted a virtual roundtable with community leaders to discuss issues and solutions addressing acts of violence and discrimination towards the Asian American Pacific Islander community. Let's listen.
These are trying times for our country and for our state right now. And since the start of the pandemic, we have undoubtedly seen a rise in violence and hate crimes targeted against our AAPI community. Let me be clear. These attacks in any form of violence, racism, or aggression against Asian Americans are not acceptable in any means. Nevada has always been and will always be a safe and welcoming place for folks from all walks of life. Diversity is our strength in this state. First Lady Kathy Sisolak and I stand in solidarity with the AAPI community, and we believe these issues must be addressed head-on.
Governor Sisolak was joined by his wife, First Lady Kathy Sisolak, and this is what she had to say.
As many of you know, I am the daughter of immigrants, and my father was the first Chinese dealer on Fremont Street. My heritage and my culture are an important part of my identity, and I firmly stand upon the belief that no one should ever be targeted or persecuted for their race, ethnicity, or the color of their skin.
The First Lady went on to enumerate some actions we can take.
Now, as we ask ourselves, what can we do, Nevadans, in order to help address this issue in our state, there are a few suggestions that have come to my attention that I would like to share. First, support the immediate needs of the AAPI groups on the ground. We can show our support as a society by donating money, and if we are capable, translation services and support and legal assistance. Secondly, I encourage everyone to speak out if you witness a hate crime or incidents. Keep in mind the techniques and guidelines to de-escalate the situation. Third, report the hate crime or incidents. If it's a violent situation or safety is in danger, call 911 immediately. Hate crimes are underreported. Numerous Asian American community leaders have reminded us that reporting an incident you experienced or witnessed can help bring greater awareness and strengthen the chance a perpetrator will be prosecuted. Lastly, never stop raising your voices and encourage fellow community members to do the same.
The fastest growing population in southern Nevada is Asian Americans. Sunny Venuya, the president of the Las Vegas Asian Chamber of Commerce, concerned about the Spring Valley area, which includes the area referred to as Chinatown, worked with the Las Vegas Metro Police to ensure increased patrols immediately following the shooting in Atlanta. Chinatown, Vegas begins just a few blocks away from the famous Las Vegas Strip. The Chinatown area is a 3-mile stretch that runs along Spring Mountain Road. It consists of buildings and strip malls featuring traditional-style Tang Dynasty architecture, filled with authentic restaurants, traditional medicine stores, and hundreds of Asian businesses. Venuya stated that moving forward, he would like to see more Asian American people run for office. He said, "We need more Asian representation so more people can understand our culture. Asian Americans and Pacific Islanders contribute to American culture and continue to shape the face of the community in Las Vegas and throughout the state." According to WorldPopulationReview.com, as of 2021, Nevada is home to the 5th highest Asian American population in the United States at 9.5%. In Las Vegas, Nevada, Lori Jarvina, Eagle News. We live in interesting times.
Immunization efforts in Texas have been progressing at a rapid pace. As EBC's Nanita Manawis tells us, the state has administered 10 million doses of the COVID-19 vaccine.
Thank you and howdy from the Lone Star State. Texas Governor Greg Abbott announced last Friday that the state has reached the 10 million mark for the number of COVID-19 vaccines administered. This is equivalent to over 30% of eligible Texans having received at least one dose of the vaccine. And beginning Monday, March 29, Texas opens COVID-19 vaccination to everyone who is 16 and older, but priorities will be given to those who are 8 years old and above. In his tweet, Governor Abbott on Thursday said that anyone 80 and older will be allowed to go to the front of the line. The Texas Department of State Health Services announced that more than 1 million first doses of COVID-19 vaccine will be shipped to providers across Texas next week. The state is also ordering 587,950 doses intended as the second dose for people first vaccinated a few weeks ago. According to DSHS, people should be able to return to the same provider to receive their second dose within 6 weeks of getting their first. Meantime, in a news release by the Texas Health and Human Services Commission, or HHSC, effective March 23, the agency is expanding visitation statewide in nursing facilities, assisted living, as well as intermediate care facilities, and home and community-based services. In line with the federal guidance issued on March 10 by the Centers for Medicare and Medicaid Services, if a nursing home resident is fully vaccinated, they can choose to have close contact with their visitor while wearing a well-fitting mask. According to HHSC, these updated visitation rules give nursing facility providers additional flexibilities conforming to the new federal guidelines. The new rules also remove certain administrative requirements for providers, such as the rules to have staff monitor certain visits and escort visitors to and from a visiting area. March is the National Nutrition Month, and on a tweet by the Texas HHSC, the agency encourages Texans to visit the Texas Women, Infant, and Children Program website for a list of nutritionists and registered dietitians that provide one-on-one counseling to tailor a healthful eating plan. This is in line to this year's theme, which is Personalize Your Plate, for there is no one-size-fits-all approach when it comes to nutrition and health. Spring is here, and so it is kitten season once again. To help guide residents who find outdoor kittens, the Dallas Animal Services recently launched a new text tool. Residents just need to type the word kitten, all caps, and send it to the number designated by DAS. Resources and information will then be delivered into their mobile device. Between April to August last year, 1,060 neonate kittens came into the shelter. DAS wants residents to be prepared for a busy kitten season, as it expects to see the same number, if not more, kittens this year. I hope everyone is keeping safe. In Dallas, Texas, this is Nanita Manawis. Eagle News. We live in interesting times.
Up next, our roundtable tonight. What lasting changes has the pandemic made in your life? You're watching Eagle News America.
Events happen around us all the time, in our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced. Eagle News, because we live in interesting times.
Arnie Aquino here at Hatley Castle, one of the filming locations for the X-Men series. Don't forget to tune in to Digital Nest only on Net25.
Start up your weekday mornings with edutainment, news, and information kasama ang inyong paboritong Net25 shows. Samahan ang inyong paboritong morning barkada sa Pambansang Almusal at 5 a.m. Tatalakayin mga pangunahing balita sa pagtutulungan ng Radyo Agila at Net25. Samahan si Weng de la Fuente sa Balitalakayan, 7 a.m. Saganang Mamamayan at 8 a.m. NHK World at 9 a.m. Eagle News International at 10 a.m. At mga balitang dapat niyong malaman mula sa Agila, Pilipinas at 11 a.m. This is your morning startup every weekday mornings only here on Net25.
You're watching Eagle News America. I'm Thomas I. Likeness. Time now for our virtual roundtable. And tonight we're going to get a little bit philosophical. You know, it's been a little over a year since the pandemic was declared, about 13 months, I guess. And I think for all of us living under restrictions, living with some fear, having this dreadful disease touch us or people we know, well, it's all made some lasting changes in our lives. Almost like going to war, you suffer a little bit of PTSD. We've been fighting an invisible enemy, and I want to find out from our people around the roundtable tonight what lasting effects has the pandemic had on your lives. And these can either be positive changes.
But I think with the personal phone calls and actually having conversations with them and hearing their live voices makes a difference for me. And also just to treat people also as if it's going to be the last time you see them, only because you're not going to know what's going to happen tomorrow. So that's one of my takes, Thomas.
Yeah, you just don't know, but I like that you don't rely on text. Text is great for information if I want to send somebody an address or something. But if I want to find out how they're doing, how they're feeling, you can't communicate that in text. I don't know. What do you think, Mayan?
Well, I agree definitely, Thomas, with Arlene's answer that you just don't look at friendship or your relationship with family the same way again. We have a deeper appreciation to almost everyone. And that is my lasting effect too, is that I have such deeper appreciation and respect to our frontline workers. Thomas, I don't look at medical workers the same way now. Like I before you would just imagine or look at them as if they're just, high earner professionals. Now you look at them, I personally look at them like soldiers, or modern day heroes.
Well, yeah, and they are the military, and like I said, we're at war with an invisible enemy, a virus, a shell of protein with some nucleic acid in it. That's what a virus is. What say you, Mila?
Yeah, I agree. I agreed with Arlene and Mayan, but what happened to me personally is this new normal. We used to call it the new normal, right? So after a year of being within this new normal, I think this is now the normal. After a year, I mean, after 1 year, and then all these vaccinations are coming. So what will be the normal now? I don't know if we can still go back. That's what my fear is. Can we still go back to the way we were before? Because right now, personally, what happens to me is I think I'm becoming OCD now. I can't go out of the house without the hand sanitizer, But the good thing that happens, especially with my family, is we started to do things together. Actually, me and my daughter we're now baking, and she even opened her small a small business for her to sell cakes. So she's been doing that. And then for my boys, we do a lot of movie nights because they love to to watch movies, and instead of playing video games the whole day, I tend to ask them to do something else other than playing video games. And now even our neighbors, they always after their online school or after their hybrid school, they come together in our backyard playing volleyball or basketball, or there's also trampoline. Our neighbors are they're playing together now, and like before they don't even know each other before, but now they're finding ways to go outside and play with each other, communicate with each other as well, which is also something that we didn't think of doing when we were before pre-COVID. Thomas?
I want to throw this out here. If, let's say in 6-8 months, we can go back to what we used to do, how capable are we of doing this? Have we become a nation of hermits where we have to learn to socialize again? Do you fear going to a social gathering, not because of catching the disease, but, it's been so long since I've been out in a social situation. Do I even remember?
Exactly, Thomas. Yes, I agree with you, because what my fear is mental health. Especially for the kids, especially for my kids' age. I was telling myself it was better, I think, during this COVID if you have a toddler, because toddlers, they used to just staying at home or doing childcare, but then for my kids who are teenagers, mental health is really because sometimes when I ask them, why don't you go out and do something outside, and they don't want to go out anymore, they just want to play games or
I just want quickly for Arlene and Mayan to weigh in on this particular topic, and then we're going to have to say goodbye. Arlene, are you afraid of socializing again?
Well, yeah. So for me personally, I love being around people, but I can tell you my first experience out in the beginning of the pandemic, I did take a drive, and I thought I was going to be going into the outlet area, but I parked at the parking lot, and I saw so many cars. I sat there, and I just started crying because I just realized I'm not ready for this. So that was in the beginning of the pandemic. Now moving forward, I still have a little bit of fear when I do see a crowd, I'll be honest with you.
Mayan, last word goes to you.
Well, Thomas, with me, I think I'm the opposite of Myla and Arlene, and actually I'm longing to be with like family. I don't know, I miss it. I'm the opposite of Arlene. The other day, I saw a lot of cars in the plaza near me when I got a haircut, and I said to my husband, it's so nice, people are out, I like it here. And one more thing, Thomas, was so funny, because we were just discussing this with my husband. The act of sneezing is never going to be the same again, because now you almost even try to suppress it. It's not like the usual that you just cover your mouth, and now you just suppress it. So that's what he said.
Now we've got to wrap it up here, and before we do, I want to salute our frontline workers, because obviously the pandemic has forever altered their lives. Let's show our appreciation to our healthcare workers, first responders, essential workers of all types, everyone out there on the front line. Let's recognize them with a round of applause. We appreciate you, and that's today's Eagle News. Thank you for joining us. I'm Thomas I. Likeness, and truly, we live in interesting times.